Every single client in your treatment room is experiencing inflammation right now. Everyone. And most of them think it's something you need to get rid of entirely. So here's the problem. That belief is costing you credibility and costing them better skin. When a client says, "My skin is angry," you probably explain it as inflammation, which is true, but it's also vague. It's like a mechanic telling you your car is making a noise. You kind of need a little bit more information. So in the next 7 minutes, I'm going to show you the difference between acute and chronic inflammation and why that distinction matters for every consultation that you do, and exactly how to explain this to your clients in a way that builds trust and changes the way they care for their skin. So this is the language that separates estheticians who do facials from skincare educators. All right, let's go. Inflammation shows up in almost every skin concern your clients bring to you. It's acne, it's rosacea, it's post-procedure redness. Even premature aging, researchers call it inflammaging. And it's a low-grade inflammation that quietly breaks down the collagen and the elastin over time. So here's what happens when you don't understand inflammation deeply enough. First, you might alarm your client unnecessarily. And that redness after a chemical peel, well, it's expected. Healthy, it's temporary, but if you can't explain why it's there, they go home and panic. Second, and this is a bigger part, you might normalize something that deserves attention. So a client with persistent low-level redness and sensitivity gets told their skin is just reactive. Meanwhile, an ongoing inflammatory cycle is quietly degrading their barrier week after week. So your clients are already researching this. They're reading about inflammation on social media, they're buying calming products, they're hearing about anti-inflammatory diets. So they need someone who can cut through all the noise with clear, accurate information. And that's you. So let's break acute inflammation down first. So think of it as a fire alarm. Your client extracts a pimple, gets a chemical peel, or they have microneedling. The skin is irritated or injured, so damaged cells release chemical messengers, cytokines, and histamines. These tell blood vessels to dilate. More blood flows to the area, and that's why you see redness and warmth. Now the vessel walls become more permeable. The white blood cells move in, they fight potential pathogens, and clean up the damage. It's productive, it's necessary, and it's temporary. So you'll recognize the signs. There's going to be redness, there's heat, there's swelling, and sometimes there's some discomfort. So when your client's skin turns pink after extractions, that's acute inflammation doing its job. Now contrast that with chronic inflammation. Now this one doesn't come and go. It persists for months or years, and it often looks subtle. Maybe a baseline dullness, persistent sensitivity, or a slight flush that never fully settles. The damage happens at the cellular level, so you don't see the emergency response the same way, but the breakdown is happening. Collagen and elastin are degrading, so the skin barrier is being compromised, and your client might not even realize it's occurring. So this is the distinction that changes everything in how you consult and recommend home care. So here's what most clients believe. Their inflamed skin needs aggressive treatment, strong active, something powerful to fix it. But the belief is wrong. And if you don't correct it, your clients will overtreat themselves into worse barrier damage. So when the skin is already inflamed, overtreating intensifies the inflammation. It compounds the barrier damage, and the most effective approach is the opposite of what feels intuitive. So your job as an esthetician and as an educator for your clients is you calm them. You calm your clients by educating them, and you calm their skin by supporting the barrier with gentle hydration. You use anti-inflammatory ingredients like niacinamide, Centella asiatica, and you let the skin's own defense system work. So this is where your expertise as a professional matters. You assess barrier integrity first. You observe, you ask questions, you avoid treatments that increase inflammation, and you prioritize barrier supporting protocols before moving to stronger modalities. So when you can tell your client why their inflamed skin doesn't need aggressive treatment, why calm is actually the clinical choice, that's when they understand you're not just doing a facial, you're applying science. So you describe inflammation as your skin's alarm system. You can tell your clients something like this. When your skin perceives a threat, an irritant, an allergen, or some sort of damage, it sends protective chemicals. That causes redness and it causes swelling. It's your skin protecting itself. Then what you want to do is you want to differentiate. Tell them that acute inflammation is that alarm going off temporarily, which is healthy. So chronic inflammation is an alarm that won't turn off, and that's when your skin ages. Then pivot to the solution. You can tell them, our job isn't to eliminate inflammation, it's to prevent unnecessary inflammation and support your barrier while your skin is healing. That's not medical jargon, and it's not salesy. It's peer-to-peer education, and it positions you as someone who understands the skin at a level that most estheticians don't explain. Now, the full blog post has client scripts you can use verbatim in your consultations, and it's linked below. You can go ahead and read it, you can use it, and your consultations are going to shift. So thank you for watching this entire tutorial. Please like this video and subscribe to the channel. It really helps us, and it helps us bring you more tutorials. If you're already part of the Deneva community, check your inbox for the trade resources that we built specifically for estheticians like you.